All right. So big toe pain, or as we call it in the therapy world, the great toe, it's very debilitating, Bob, as you know, and it's oftentimes associated with a limp.
Yeah.
We're going to show you how you can take care of this with home treatments. And so just hold on. We'll be right there.
Bob and Brad, the two most famous physical therapists on the internet.
Okay, big toe pain, common causes, and that's what we're mostly going to cover. There's a
Right.
few other ones, but one is gout.
Sure.
Gout is a form of
Real common.
Yeah, and from what I've read, it's just a form of arthritis, but they call it gout, and it's usually associated with a high level of uric acid and crystals.
Yep.
And for some
In the
reason,
joint.
it goes to the great toe.
Right.
The big toe joint is the vast majority of the time where it presents itself. Also, bunions, typical arthritis in the toe joint can happen over time. And I know
Right.
I have a friend of mine, she actually has both of her great toes fused as a result of
Bunions?
no, just arthritis.
Really?
Yeah.
Wow.
Yeah, absolutely. So we want to avoid that. This video doesn't really pertain to stubbing your toe.
Right.
With the exception of the first phase, and you'll understand it in just a second. So we'll
Let's
stop.
get to it.
Oh, we're going to get to it. Okay, Bob, we're going to talk about the acute phase. In other words, it's
Right.
not cute physically. It hurts.
Right.
It's all of a sudden
It just happened.
yeah, it's just flared up in the last
Right.
day or so. You may not know why, or your gout flared up, and you'll know it because here. Let's take a look at this. We're looking at your big toe, and it'll be swollen. It'll be red. Painful when you walk, you limp because every time you put pressure on it, it's very irritating. So what you're going to do is NSAIDs, if
Right.
that works for you.
Non-steroidal anti-inflammatory
Yeah,
drugs.
oftentimes
Like ibuprofen,
ibuprofen. It could
aspirin.
be could be Tylenol, whatever works for you and what your doctor allows you. Make sure you drink plenty of water. If it has, particularly if it's gout, you're going to elevate. If it's swollen, it's going to be helpful to in a recliner or actually laying down. Elevate with pillows your foot above the level of your heart. That's going to help reduce that a little bit, and avoid walking and irritating.
Yeah,
it.
the doctor might give you a prescription too.
Right. And if it is for gout, what I've read and heard is the diet.
Right.
And
Certain
rich
foods you
Yeah,
gotta avoid.
avoid the sugars and all those things that are
It's
inflammatory in
different
nature.
for different people.
It is, right. Next one, address your footwear. There's a very strong chance that your toe was irritated by your footwear.
Yeah, it's getting squished
Yeah,
together.
the toes are too narrow. You don't have a big enough toe box, and you may have a shoe that you've been wearing for a long time, and once the swelling starts, that just compounds it and it gets tighter and tighter and tighter. So you're
Very common
so
to have too narrow of shoes.
go without a shoe. Bob and I have just started wearing
I
these
got mine here.
minimalist shoes.
Right.
They've got an extra wide toe
Look how
box.
wide it has.
Yep, there you go. And that can be worn, and they're a nice thing if you have this problem coming over and
Right.
over again. Get a shoe. You don't have to have the minimalist, but make sure you get the extra
wide base.
wide toe
Right.
box, we call that. Next thing, again, avoid walking, particularly on uneven terrain where it really stresses that toe.
Yeah, for the short term.
Right,
You don't have to do
exactly.
it forever.
And just to use a cane may be helpful, or a
Right.
crutch.
For a while.
Yep.
Again, short term.
If that's my sore foot, I'm going to use it in the opposite hand. And you'll know because it's going to reduce the pain by a fair amount, at least 50%. And when it gets better, put the cane back in the closet. Now, let's get into chronic pain. Let's say your big toe has been hurting. It's kind of gradually getting worse over the last few weeks or months. And you kind of ignored it for a number of...
Right.
And now it's
Hoping
getting...
it was going to go away.
Yeah, and it doesn't. All of a sudden, you start limping, and sometimes
Right.
people will start limping without knowing about it because it's so gradual. And then someone says, "Why are you limping?" And it's,
I didn't know
it
it was.
It must be because my toes are getting worse.
Right.
So, number one thing is check out your footwear again. Make sure you've got the wide enough toe box, and you're addressing that. No high heels for sure.
Right.
Those.
They're Gonna squish your foot down into a narrow base.
I don't think they make a high heel with a wide
Right,
toe box.
Right. Maybe I'm wrong.
Okay, so the next thing you want to do, it's probably a good chance is arthritic
Right.
changes in that big toe joint. So we need to get that joint ranged out or get the flexibility back where it needs to be. So I'm going to show you what I like to do. And I had
Gotcha.
I was instructed just initially a number of years ago in a continuing ed course, and it was called When the Foot Hits the Ground.
Everything changes.
Yeah, there you go, Bob.
Right.
Did you take that course?
No, but I remember it.
But anyways, we're addressing the big toe. Let's look at this. Here I got my nice skeleton toe socks on.
Right.
Are we on this? So we've got,
The joints.
yep, the joints. So the bone way out at the end, and then we've got a middle one, and then here is the joint that usually gets the most problems.
Right.
Okay. So to get that joint mobilized, I'm going to suggest starting with a gross stretch or range of motion.
Right.
And we're just going to go down as far as you can and then go up, but not too aggressively to start out with. Do a few reps of that down.
Get it warmed up.
Yeah. And you notice I have my toe or my foot on a surface that's firm, so I have a distinct point of flexion there. And I'm going to stabilize here to go up. So we're working those joints, and we're not just moving the whole foot up and down.
Right.
That's the big concern there. Okay? All right? 10 reps is probably pretty good. And then you can grab the toe. This is rather interesting. See if you can stabilize this. You can do this
I was going to say. you can
seated
sit
like
down,
this as
right.
well. But just for viewing sakes, I'm going to do it like this. I'm going to stabilize this joint here, push it. I'm going to grab that toe and do some rotation.
All right.
Yeah, which is, a lot of people won't think about that. Like Mulligan, the famous
Right,
therapist.
exactly.
He talked about this. And you may go out here and rotate it again. I always think of this as like, you got some rust in those joints. You're trying to break the rust up and get
Sure.
things moving again.
Get the joint moving.
Yep. Then the next one, and particularly if this is a bunion problem
Right.
and your toes are being squished in all the time, we want to move that toe out and get that space in there. And you can go in, but usually this way is fine. It's typically out and back and forth and work that. And you can do some rotation with that outward motion.
Right.
Okay?
Whatever feels good.
Absolutely.
Right.
Okay, good. Now, the next phase is to get into that joint. And now, this is not range of motion. This is mobilization.
Mobilization, right.
So I am going to really stabilize. Let's look at this. This bone right here, I'm going to grab that. I'm going to get a hold of this bone, and I'm going to really focus on that joint. And I'm going to do it just
Moving
like
up and
so.
down.
Yep. So I'm going to grab here, and I'm going to do some vertical mob. So my hand here is going up this way.
Gotcha.
All right. Stabilizing here, and I'm going to go up. Now you can see if you really zoom in, there is some motion there, but it's not a lot, and you won't get a lot. And
I can see it.
Yep, it's there. And if I push down, again, not a lot, but there's some motion there.
And if the toe pops off, just plug it back in.
Yeah. Make sure you keep it. The other thing that oftentimes is missed is you grab this bone here and the bone here for the next toe, and I'm going to go up and down like this.
Right. Like a teeter-totter.
Yep. And for all these stretches, you can go through the whole foot, and it's not a bad
Right.
idea. I'm focusing on the big toe because that's what we're talking about. Work that. And then I'm going to go grab the next joint here. I'm going to grab there with 2 fingers, and then I'm going to stretch that, flex that down and up. And I'm going to go up and down, do a little rotation with that, back and forth. So I'm just really isolating when we do
Yeah,
mobilization
really
versus.
trying to get into the different joints.
Yeah. Even if you don't have a toe problem, you do this.
Right. It
When
feels good.
Yeah, when I went to that course, the teacher, I don't know what she was doing. I do know, but she grabbed my foot and she's pushing down pretty aggressively. And I thought, oh, that hurts. And I was trying to be tough. Oh, it kind of hurts, I said. She like going, like, thank God. But like a minute later, it just felt so
Felt really
good
good,
because
right.
my toe had never been stretched like
Hurt
that.
so good.
It did afterwards, and that's the idea with these. Stretch them to the point where there's some pain, but after you get done, it should feel better. If it doesn't and it hurts, doesn't mean you quit doing it. You give it a rest for a day or so and then come back.
Try it again.
And don't do so aggressively.
Right.
Yeah. My toe is feeling better already, Bob. All right, let's address the old bunions.
Right.
And bunions, we talked about stretching a little bit, but we're going to show you an easy way to stretch it that you can do without actually stretching.
They would definitely cause greater toe pain. I mean,
Yeah.
a bunion.
Yep.
So, and if your foot is getting squished together, you want to stretch it out.
Right, particularly that big toe.
So we're using some yoga toes here. And I just put them in place, quite stylish.
So we've got gapping, and you can see the gap is bigger for the great toe or the big toe, but we also gap the rest of the toes because I want to stretch all that out. And so how long will you leave those on, Bob?
Well, I start maybe only like 5 minutes.
Sure.
Walk around with them,
Yep.
see what you can do. But eventually you could, walk around for an hour with them on.
Yep, and leave it stretch out,
Right.
but not all day long.
Right.
Yep. Now, if you don't have those and you don't want to buy them, you can make something at home. I just took a pencil. You can use some gauze, anything that's
Right.
clean. This is Coban, which is actually used for a number of things, but they make medical grade. And I wrapped it around just to get a diameter that I need. And I'm going to cut this off. And what you do is you just put that between your toe like that, and look at the gap it's made.
Right.
I've got a stretch going on there. Obviously, I wouldn't leave this pencil like
Right.
this. You're going to use something short that would be cut off or
Sure.
or whatever. But you get the idea. You can use something that's going to fit in there, and then you could just watch TV or hang out for a
So
while.
apparently there are little rolls you can put in your toes to do your toenails.
Yeah,
Yeah,
well,
you could use those
absolutely.
too.
Absolutely. Be creative. You don't have to buy anything, but that would work too because some people, you still do your toenails then?
Yeah, all the time.
See what I'm talking about? All right, well, very good. I hope these exercises and these tips with the shoes and stuff help you with your toe pain, get you walking normal again, feeling good, and maybe you can go out dancing, perhaps a little ballroom dancing,
There we
Bob.
go.
Enjoy the
Rumba.
day.